Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, former President Jimmy Carter explained his cancer diagnosis in a candid news conference this week. The 90-year-old said that after doctors removed a tumor from his liver, they found 4 small spots of melanoma on his brain. John, how do they treat that?
Well, the 4 tiny spots they're going to treat with radiation, and there's a new drug, pembrolizumab, which revs up the immune system. Cancer kind of cloaks itself from your immune system. This uncloaks it. And in terms of prognosis, the doctors are being very guarded. They're not saying specifically about his prognosis, but I can say in trials, this drug has been very helpful, at least for the first year or two. It was just really approved about a year ago.
Whenever I hear melanoma, though, I think of skin cancer.
Right.
Is that what most people think of, right?
Yeah, and actually you should. The vast majorities of melanomas actually originate in the skin, although they can originate in other parts of the body, mucous membranes internally. We don't know if Jimmy Carter's melanoma started in the skin. We do know that it has spread. It has spread to the brain and the liver.
It is extraordinarily unusual to have a former president come out and be so candid like this.
Yes, and what an example of grace under pressure. When I think about how open he was in discussing specifics of his treatment of his problem, earlier on in my own career, we would call it the C word. Nobody wanted to even say cancer. And when you did that, when you hid it from your friends and your family, you were cheating yourself of their support. I found it so interesting that in answer to a Bill Plant question, he said he was surprised that he didn't feel despair or anger. And I think part of the reason for that is that he had the support of his faith, of his family, of his friends. So what a great national lesson this is.
All right, the first prescription drug to boost women's sex drive is set to hit the market this fall. The FDA approved Addyi this week after years of debate. The pill's designed for premenopausal women with hypoactive sexual desire disorder or an unusually low libido. Holly, initially this was rejected twice. Why is the third time the charm here?
Well, you know, Anthony, it's not exactly clear whether the third time was the charm or the third time they just finally wore them down. But you are correct. In 2010 and in 2013, the FDA declined to approve this medication, really for 2 main issues. One was the side effect profile is significant. It causes nausea, sleepiness, low blood pressure, even fainting when it's mixed with alcohol. And there were questions about exactly how effective the drug is. In clinical trials, it only resulted in up to 1 extra sexually satisfying event per month. But the maker of the drug, Sprout Pharmaceuticals, launched a big PR campaign, got a lot of public support, and possibly that played into the FDA's decision.
When I hear that laundry list of side effects you just mentioned, it makes me wonder, will the FDA then step in and say, here's what you have to put on the bottle?
Yes, and in fact, they're putting box warnings on it saying about the risk of low blood pressure, fainting, as Holly said, when used with alcohol, and warning about its use not only with alcohol, but in people with chronic liver disease, taking certain medications. And they have gone the extra step of saying the possibilities of side effects are so high that we want only certified health professionals and certified pharmacies to actually prescribe it and to give it out. So side effects are a big deal.
Well, new research found long days at the office could pose a serious risk to your health. A new analysis finds people who work 55 hours or more a week have a 33% higher risk of stroke. That's not great news for all of us at this table.
I know. We're like, okay, let's just go home now.
Yeah.
This is one of what's called a meta-analysis where they combine a lot of other studies together. So it's not the perfect study, but what it found was that if you worked 41 to 48 hours, your risk of stroke went up 10%. 49 to 54 hours, it went up 27%. And 55 plus, all of us here, it went up 33%. Now, why might that be? Who knows? They postulated that it could be because of the increased stress, because of high blood pressure, because if you're aggravated at work, or even just being sedentary. We've talked before about how just sitting around can increase your risk.
Does it matter, Holly, what kind of work you're doing or how you spread those hours out in the week?
Right. You know, it has a little bit less to do with exactly what your work is, but more about your relationship to your work. So people who feel like they have more control over their work and control in their workplace experience less stress. And we know that stress plays a huge, huge role in stroke. It raises our blood pressure and directly raises our risk of stroke for that and many other reasons. But as John mentioned, there are aspects of the actual physical work. If you work and you're sitting down for 55 hours, you're more sedentary, you're getting less exercise, not good for your cardiovascular health. So there are so many things that could contribute to it.
There are way too many of these stories that seem to apply to the people at this table. Yeah. All right, here's one that doesn't apply to me. A new survey finds contact lens wearers might be turning a blind eye to hygiene. More than 99% of lens users admit at least one risky behavior in the survey. 82% say they wore contacts for longer than recommended. 55% say they've added new solution to old solution in a case. And 50% revealed they've worn the lenses while sleeping. As a result, the CDC says nearly 1/3 of the participants needed care for eye problems that might have been prevented.
You're not guilty, but I am.
Are you?
I do. I mean, I had never even heard that you couldn't put the old solution in new solution with the old solution.
Because then it becomes a mixing chamber. Yeah. So unless you totally empty it, the schmutz that's in it, you're just diluting it, and then
it's all schmutz up in here.
Yeah, you have to empty it and clean it, and then put the new stuff in.
It doesn't look like schmutz, though. That's all that matters.
So many people wear contacts, though. So I think this is obviously an important one.
And they're so comfortable, you can fall asleep in them. I have done that.
Yeah. Well, finally this morning, it turns out a friend and a smile can go a long way to improve your mood. British researchers found a healthy mood can spread amongst friends. The researchers also say happy, healthy moods can help prevent and treat depression in a person's social circle.
What I find most significant about this is just to reiterate, depression is not contagious. You know, there's this sense of just surround yourself with positive people. You don't want to be around anybody who might be going through a hard time because you can catch it or it can bring you down. This is actually showing the opposite. If you are up and the other person is not, you really can help them and then get some value out of doing that too.
But you shouldn't be afraid. I like that part too. You shouldn't be afraid of being around people who are depressed. You're going to bring them up. They're not going to bring you down. And this is why I hang around here, because of all the happy, contented people.
That's it.
Morning rounds.
That's it. See?
Just wait till the commercial break.
Despite that we work over 55 hours a week. Okay, Dr. Jon LaPook, Dr. Holly Phillips, thanks so much for being with us.